डिजिटल इंडिया के लिए ज़रूरी है डिजिटल हेल्थ केयर। इंडिया का हेल्थ केयर सेक्टर फास्टेस्ट ग्रोइंग सेक्टर है और कंसिस्टेंटली ग्रो कर रहा है। इसकी ग्रोथ में बहुत बड़ा योगदान हेल्थ केयर स्टार्टअप्स का भी रहा है। जी हाँ, इंडियन हेल्थ केयर स्टार्टअप्स अपने प्रोडक्ट्स और ऑफरिंग्स के साथ पेशेंट्स की लाइफ ईजी कर रहे हैं और कई ऐसी सुविधाएं प्रोवाइड कर रहे हैं जो पहले मुमकिन नहीं थी। इंडियन हेल्थ केयर स्टार्टअप्स एक ब्रिज की तरह है जो लोगों के डिमांड्स और नीड्स को उनके सप्लाई से जोड़ रहा होता है, मिला रहा होता है। लोगों का भी भरोसा इन हेल्थ केयर स्टार्टअप्स की एप्लीकेशंस और सर्विसेज पर काफ़ी बढ़ रहा है। पहले के तुलना में कई सारे ऐसे स्टार्टअप्स हैं जिनका यूजेज इंडियन पॉपुलेशन में काफ़ी देखा जा रहा है। मेडिसर्कल इन्हीं इंडियन हेल्थ केयर स्टार्टअप पे एक सीरीज कर रहा है जिसमें हम हेल्थ केयर स्टार्टअप्स के फाउंडर्स, एंटरप्रेन्योर्स, उनके सीएक्सओ से बातें करके ये जानना चाह रहे हैं कि उनके प्रोडक्ट्स और उनके ऑफरिंग्स किस तरह से इंडिया की सोशल और इकोनॉमिक ग्रोथ में कंट्रीब्यूट कर रहे हैं, और साथ ही साथ जो हेल्थ केयर के 3 इंपॉर्टेंट चैलेंजेस हैं जैसे कि अवेलेबिलिटी, एक्सेसिबिलिटी और अफोर्डेबिलिटी, इन्हें भी वो कैसे सॉल्व करने की कोशिश कर रहे हैं। तो आइए इन्हीं हेल्थ केयर स्टार्टअप से जानने की कोशिश करते हैं कि वो किस तरह से लोगों को बेटर पेशेंट एक्सपीरियंसेस प्रोवाइड कर रहे हैं और हेल्थ केयर को और डिजिटलाइज और सक्षम करने में इंडिया की काफ़ी सहायता कर रहे हैं। COVID-19 pandemic has exposed the deep vulnerabilities and inherent gaps of India's healthcare system. The outbreak of COVID-19 posted both a challenge and an opportunity for Indian healthcare startups. Despite several inherent challenges, startups promptly engaged themselves and developed solutions for the COVID-19 applications in the areas of prevention, detection, disruption management, and operational efficacy, and have provided innovations in medical goods and services also. We at Medicircle present to you the Healthcare Startup series, wherein we are interviewing the healthcare startups which have shined through in this pandemic. Hi, I'm Smita Kumar, and today our guest for the startup talk is Sundararajan Srinivasan. So Sundararajan is the chairman and the MD and the co-founder of Ubiqare Health Private Limited. He has been developing and leading innovations in India, Asia, Europe, and US over the past 35 years. He has covered a range of technology areas in computing, communication, and control. In his early career, he has pioneered indigenous digital power plant control systems for small hydro-based cogeneration plants in the sugar industry in India. He has also led global R&D functions in Philips, NXP, Intel Mobile, GmbH in Munich, while leading development of mobile platform softwares. He has served as a member of the governing council of TSDSI, which is Telecom Standards Development Society of India, and has led the creation of Telecom Standards Roadmap for India. Sridhar Pillamari is the CEO and co-founder of Ubiqare Healthcare Private Limited also, and Sridhar has held global leadership positions in various organizations at various levels of management since the last 33 years, with about 20 plus years of experience in the senior executive roles. He's also associated with few NGOs and social organizations such as Indian Cancer Society, Bangalore, Sanman, and has been actively volunteering to help in cancer screening activities and helping grow volunteers to support hospice, hospitals, and other organizations. Prior to starting Ubiqare Health, Sridhar was the managing director of Max Linear India Private Limited and has helped set up its operation in India. Hello, Sridhar and Sundararajan. Welcome to Medicircle.
Thank you.
Hello. Thanks for having us.
So to begin with, both of you, the IBF estimates like that the Indian healthcare industry is to be worth $372 billion by 2022. So healthcare is possibly the most varied sector with startups categorizing across different verticals like telemedicine, online pharmacy, personal health management, fitness and wellness, medical devices, home healthcare, diagnostics, biotech R&D, the list is too long, genomics and biopharma. So in your view, how are the Indian startups contributing to the economic and social growth of India?
Yeah, So should I go first, Sridhar, or?
Go ahead.
Yeah, I the way I look at it is all the startups, singly and collectively, are reshaping the healthcare industry at a certain slow pace. And one fine day, they will all add up, and suddenly you will realize, hey, you know what? I can get this done in a very different way. I think that's the beauty of this. While this reshaping is happening in several ways, right? I mean, Sridhar already talked about access, for example, right? There are also different efficiencies coming in. I mean, you don't have to wait for one day to get a radiologist report anymore, right? You could actually get it immediately in 15 minutes. You could even have a suggestion to the doctors that this is such and such a thing is to be looked at. You don't have to go back to hospital again and again if you have illnesses like cancer or stroke or respiratory disorders. For a 96% or 95% of the time, you could actually be taken care of at home, and you don't have to go make the trip back there unless it's really required. So the whole industry is undergoing different reshaping, if you will. How it will end up is anybody's question, and that's part of the excitement of the journey that we are in, right? A lot of digital data comes in here, and a lot of AI is thrown in, and of course telecommunications and cloud computing. Practically all the technologies are arranged to bring in this kind of transformation, and how it will all add up is something that we will see.
Sure. Actually, if you look at the healthcare in a very simple, strict terms, right? The three large boxes. I mean, in sense, if you look at the flow, there's a what you call the diagnosis stage, when somebody is feeling ill or something else. So there's a mechanism of having diagnosis, right? Then there's a treatment stage when somebody is being treated for whatever is required. And if you look at a follow-up stage, a rehab stage, or something, what happens post the treatment. In all these spaces, you can actually, if you look at the last several years, startups have been coming in, making a lot of inroads, and actually developing things which can actually contribute to a large extent. As I mentioned in the beginning itself, it's basically technology can bring a lot of things in place here. One, to focus on the end-to-end solution in any specific problem. Like Sundar mentioned about radiology, there are a lot of startups who are actually focusing on how to basically ensure this turnaround time of how the report actually reach in time. You have the access problem where we should be possible to reach out. There are certain parts of the country where you really have a sizable good amount of healthcare, but a vast population doesn't really have it. There are several startups, not today, has been focusing on how to bring in technology elements, both in terms of diagnosis and in terms of how follow-up care can be provided for. Of course, the major center is healthcare, is physical. Both Sundar and me, I mean, both of us have 30 plus years of experience in industry, embedded space, technology. And when we started this journey into healthcare, we actually felt that, it's easily feasible to put the technology efficiencies into possibilities and move on. There's a lot of learning we had to undergo in this process. We understand healthcare, and there's a lot of movement in the direction. There is a need, or the market has a definitive need, but there's a way at which it has to be handled and processed and to put in front. So that's why I keep telling that one has to take a problem and go all out to put end-to-end connection in place, whichever startups, and there have been several startups working on that, and whichever have focused on that have really won and been able to move in a different direction. So there's ample opportunity, there's ample scope, and a lot of work is already happening. And it's exciting times. Like Sundar said, where it ends to, which way it went to, it's a question of how this entire thing shapes up. We have some vision. There are different startups having different vision. Everything will collaboratively come to some conclusion, which is definitely going to be the right thing to happen at a point.
Definitely.
I'm very positive about what is going to come.
Definitely.
Yes.
So,
and also on the economic part of it, what you mentioned, I think this will also change the economic landscape, because see, hitherto what has happened is healthcare was centralized in one place. You have to go to a particular place, which is a hospital or a healthcare center, where economy of scale exists and all the skilled workers would come there. We are now looking at a scenario where when you extend it, and if it really gets deployed, or when it gets deployed, a lot of people who are away from that central place would also participate in delivering care. So there is an impact on the livelihood, there is an impact on the distribution of wealth.
Yes.
All those impacts will come in, and you will probably no longer have everybody has. I mean, the centralized hospitals don't have to be the only place where you get 100% of your healthcare, right?
Definitely.
Close to 40 to 50% of your healthcare would come away from there. The expenses would come away from there. I think that's the kind of a vision that is unfolding according to what we see, and that's why we even embark. Our name of a company itself is Ubiquitous Care, Ubiqare for ubiquitous care, and that's where we are trying to push towards.
Definitely. So, how is like Ubiqare shaping the future of healthcare? Like, what are the products and offerings, and how is it helping digitalization in, especially in healthcare?
So what we have done is basically focused on the follow-up care. That's how we started with. We looked at diseases with complex illnesses, which require, I mean, home healthcare has been in practice. I mean, you can see the home healthcare market also sizably growing.
Yes.
But primarily a large chunk of home healthcare was focused on primary care, nursing, caretaker, somebody who is being available. We ourselves, both Sundar and I, in our own families, we have seen situations where complex illness like cancer does require a whole lot of attention a simple nurse or caretaker cannot do. Post-discharge from a hospital, when somebody really has to basically have an access to a doctor, it's
Yes.
not always not possible, right? So some of us may be better in terms of because they have family and friends who are doctors, but not everybody has. And the concept today, a family doctor is almost disappeared. So when you actually migrate to a city, you're almost like uh, you're a small family, husband, wife, and maybe children, maybe your mother to be taken care of. The question right now is the follow-up care has a lot of requirement of actually having a doctor connect. That's where Ubiqare, we actually started focusing on how to take care of follow-up care through mechanism of having access, the technology does exist, connecting a doctor, how the protocol of a specialist can be executed at a home, how a doctor can supervise things, and how configurable workflows can actually work in a way that a care can be done where an end-to-end mechanism of somebody getting discharged from hospital can really be taken care of at home through a collaborative framework of all the people who are existing to help the patient have a better outcome. That is where we started our journey with. And we actually looked at and understood their need. We tied up the business model. We actually tied up the collaborative framework and ensured that the end patient does get the right supportive care. And when we started, we looked at palliative care as one of the instances, and we looked at some other supportive care for stroke and cancer patients. And it did make an impact. We had a startup, we started in Bangalore. The patients liked what we have done. Some of the doctors and specialists have recommended what we have done. So it was a very good journey. And we are taking it to the next level of seeing that, how we can use that to enable as a mechanism of a collaborative framework for people and other healthcare organizations if they want to extend their care to patients at home.
Yeah, and like I mentioned earlier, I think the model is proven. What I think the challenge in front of us is how do we make it scalable? How do we make it applicable in multiple places? Places where the resources are not so much as in the city, right? So how do you do that? Expertise is not easily available. Where there would be a question of skilling also coming in. Do people in the remote places have the skills to uh, to actually carry on the work that is decided by the specialist? Is there an angle of empowerment there? Can they be empowered to do things that they were otherwise not able to do? But there's a lot of social impact actually coming in here, which is quite excites us. In fact, that makes our work very meaningful. One of the reasons why we quit our companies and joined this is we wanted to focus a part of our lives on making impactful innovation. And like one of the points that we principles that we used was coming from the tech background, one would have expected us to sit and develop a nice tech first and then go and try to fit it in the market. We flipped the whole model. We said, no, we first immerse ourselves, discover what are the points, and then come up with a product, and then slowly bring in the tech once adoption is understood. So that has been our approach as well.
Definitely. So, as there has been a lot of advancements in healthcare, let's talk about there has been a lot of advancements in healthcare, but is it getting accessible and available to the remotest of the pins of India? So, like with this advancements which is happening in the industry, it has been complex, it has been expensive also, and we have find organizations which are serving in the areas which are already developed. So, how do you think we would be able to achieve this equity in healthcare? Like the healthcare services are actually available and accessible to the remotest of areas in India, especially the remotest areas of India.
Correct. You want to take
Okay,
it, Sridhar? Or
sure. So
okay.
what you said is right. I mean, in sense, can technology solve the access problem to go and provide healthcare things to the remotest part? Uh, in a way, yes, because if you look at it, telemedicine has been there for a long time, and there has been deployments and people have leveraged it. Has it really solved the problem in terms of it really completing all the places? No, there's a lot of direction, a lot of movement yet to take place there. So if you, I mean, like if you put the problem in a scale, I mean, let's say in a scale of 1 to 10 and say that where are we? Yeah, maybe you are in 4 or maybe you are in 5. Is the direction on the positive trend? Yeah, of course, in the direction of the positive trend. So the question with respect to equity is going to happen. I mean, if the government of India's the insurance program and covering all the people and covering the equity is a step in the direction. Digitization of health records is definitely a step in the direction. Because of the pandemic and ensuring that the telemedicine guidelines actually published and putting in the direction is a step in direction. This will all lead to a mechanism where everybody, it's a collaborative play ultimately. Everybody coming together, ultimately delivering a solution to a person at a remotest corner. Is it feasible? I would say yes, of course it's feasible. Is there a lot of work to be done? Yes, there's a lot of work yet to be done to actually reach there. Ubiqare, for example, when we started, whatever we are talking about follow-up care and enabling healthcare organizations with a platform to ensure the follow-up care actually goes there, we are looking at building up, like Sundar mentioned, the 40s, right? So the question right now, the specialists at a location, maybe in an urban center, that a local doctor available at a remote location, maybe a healthcare professional or maybe another medic or a nurse available at that location, and ensuring that all these people can be tied up and connected together as a mechanism to deliver care is something which is very easily feasible uh, in the workflows, in the protocol-driven, doctor-driven specialty medical care platform which we have envisaged. Of course, digitization, of health records, putting in AI, and ensuring that critical care is available as and when needed is something which will all come into play. A lot of startups have already made and shown it possible. It is in the right direction, and it'll happen. And so that's what I would say at this point of time. There's a
Yeah,
lot of
I
work
think
yet to
that
be done.
yeah.
Definitely.
So just a few points that I wanted to bring in addition to what Sridhar mentioned, is that um, the reason why expertise is so much sought after in healthcare is that accuracy is so important in healthcare diagnosis and treatment, right? You don't want to trust your health to anybody else who is less than the best, right? Everybody wants the best doctor to be there. And so we have a problem of the expertise being confined to a certain place. And it's not just telemedicine, but also digitization of health, the digitization of care protocols. They actually can play a big role in empowering people far away, and disseminating the expertise. I think that is one play which we should be able to see more and more coming up. A lot of startups are working in those areas. Unfortunately, there is also a concern that there is an attempt to replace the doctor. But actually, I think that's where one should be very clear that healthcare being what it is, the focus is not to replace the doctor, but extend the doctor, extend the expertise. I think that's one paradigm that we actually are trying to bring in all our products, that we are extending the care from a known expert or a known place of expertise to a place where that is not easily available. And it is not just the communication, but it's also the protocol and other things that makes a difference. The second thing is that the team, which was earlier in the centralized hospital, were actually trained and skilled. The team that is distributed also need to be skilled continuously and brought up to speed. So that's another paradigm that we have to bring in. Otherwise, the divide will not get bridged. I mean, people have to trust that these people are the general practitioner in the village is quite well educated, continues to get educated, is aware of the latest, and is able to, we can trust for that. How do we get to that? A lot of technology can play a role in bringing that to that level. I think that would make a big difference. The encouraging thing that I was trying to say is the broadband network is penetrating all over. So that's one very good thing. And if that momentum continues, then dissemination of information, even telepresence is not a big deal. I mean, we could actually, people can reach out to people across all those things, and people can coach each other. I think that could be a different exercise, and all those medical education startups or other companies which are focusing on that, even medical colleges themselves, would probably focus on how to educate their doctors, not only to assess and treat patients in front of them, but also how do you assess remote patients in collaboration with people and treat them from remote. I think that is a big piece that is probably lagging behind currently, right? We are still churning out doctors who are very comfortable when I just look at a patient and then or go and get a lot of investigations done, and then I will see what needs to be done. We are missing something there in that sense.
So thank you so much, Sundarajan and Sridhar, for sharing your views and experience with our viewers today. I definitely hope that through this initiative, we are able to make people aware of the Indian healthcare startups that are creating a difference in the healthcare ecosystem. Thank you once again for joining.
Thank you, Smita. Thank you for having us.
Thanks.
It was a pleasure.